Ohio approved and licensed for disposal, at Ron Evans Enterprises, they specialize in sewage system installation and repair. Ron Evans has a full line of flex pipe, culverts, concrete and plastic septic tanks, sewer fittings, waterline rolls for the Home American water heaters, along with toilets, standard and ADA. It's all at Ron Evans Enterprise, LLC. Give them a call today at 1-800-537-9528 or 740-286-5930.
Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Bellisio Foods is looking for you. That's right, Bellisio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Bellisio Foods is a company that truly values their employees. Apply online at BellisioFoods.com/careers.
Well, good morning, everyone, and welcome to the morning show right here on Main Street TV, where it is a very, very dreary and blecky Monday, but it is warm outside.
It is.
Yeah,
If that's the worst we have, we're okay.
that's something.
Yes, exactly. Pull your mic up just a little bit there.
Sure.
Yeah, thank you. They're a little sensitive.
Okay.
So, well, we have some very, very special guests in the house today. Of course, some friends from Holzer, which we always, always love to have here on the program. And you have to pardon my sinus, whatever is going on. See, we have doctors here. Maybe they can, or a doctor here, they can help us along the way. But anyway, could you introduce yourselves? And then we are going to get to some interesting topics today.
I'm Ashley Smith, the OBGYN nurse navigator.
Okay.
And I am Dr. Robert Bowers, OBGYN at Holzer, Gallipolis, and Jackson.
And Dr. Bowers, of course, has been here before.
Yeah.
We talked about all kind of fun stuff when you were here. And but today we're going to talk about something very unique, I guess.
That's a fact.
Yeah.
Yeah.
So I walked in late. I was chasing my corgi around the horse field because she was not wanting to come in this morning. So I'm looking at these questions. So I didn't really have time to prepare much, but you guys threw me a loop. So
We got you.
yeah, absolutely. So first off, nurse navigator, let's talk about that for a minute. Could you explain what that is?
Sure. I do a lot of scheduling for OBGYN.
Okay.
So scheduling deliveries, scheduling procedures, and also upkeeping our doctors' schedules.
And that sounds like that would be a very, very consuming job.
It's a
That's very
job.
consuming.
It's a job. We change our schedules like we change our pants. It's terrible. That constantly she's putting new schedules on our desks because somebody had to switch this call shift or that call shift. Yeah, it's a full-time job for sure.
Well, and it would be because let's just be honest, babies, you can't really control whenever they decide to be born and whenever they want to come out or not come out
Right.
or
Right.
whatever. So yes, it would just be a constant ongoing
Mhm.
shift in
It definitely is.
change. Yeah, I gotcha. Well, cool. So Dr. Bowers, when you were here before, we talked about some of the stuff that you do, but in
Right.
case somebody wasn't, happened to tune in that day, could we talk about a little bit about, what you do there at Holzer and where you see patients, that kind of thing?
For sure. So I specifically see patients at the Holzer Gallipolis location and the Holzer Jackson location. We do have OBGYN services also at the Meigs branch in Proctorville and Athens as
Oh,
well.
yeah.
Yeah. So we offer those services all those places. I only see patients in Gallipolis and Jackson. Some of the services that I offer include obviously obstetric care.
Mhm.
So for during pregnancies, also just office gynecology care, which is just normal well woman care,
Yes.
and then gynecologic surgery. I don't know how I got shoehorned as the pelvic floor guy. So like when things aren't sitting where they used to be, I put them back where they're supposed to go.
Hey,
Um,
listen, that's good.
Yeah.
Mhm.
And so
Thank
I do
you
a
for
lot of
that.
that. Yeah, absolutely. I do a lot of that.
You do.
Um, And then I also do Da Vinci robotic surgery as far as if you have like a difficult hysterectomy for a patient who has had multiple cesarean deliveries or multiple other surgeries, or maybe they have really bad scar tissue from endometriosis or things like that. Then I can do those robotic procedures. There are 3 of us that offer those services, and I'm one of those. So
That is very cool. And can you
yeah,
kind of give like a little bit of background on the Da Vinci? I know we've talked about it before here
yeah,
with a couple of the docs, but yeah,
yeah,
has kind of like, I mean, you're talking about like robotic stuff. That's pretty
yeah.
neat, like
It is.
technology.
It is. It's really neat, and it just keeps advancing every year. Even just software updates
I was
and
gonna say,
hardware
does it like
updates. And,
update and
oh yeah,
all of that, and so then it can
absolutely.
help you even more? And
Yeah, absolutely. Um, I've heard. I don't know this to be a fact, but I've heard that originally robotic surgery was developed by companies with contracts with the military, because you were going to have like a very specialized vascular surgeon sitting in Chicago doing surgery on a patient in Afghanistan remotely. So how cool would that be, right?
whoa,
Yeah, but then
wow.
obviously that went into the private sector, and there were a lot of applications there as far as surgeries that are technically difficult and in hard to reach places. So a lot of urologists will do robotic prostatectomies. So for like prostate cancer, that's a really hard place to reach in the human body. Um, Anything as far as pelvic surgery, so hysterectomies, oophorectomies, which is like ovaries and things like that.
Okay.
All those places that are kind of hard to reach, robotic surgery does a really good job of assisting the surgeon and letting them be like the best that they can be.
So how does it? This is so fascinating to me. Is it so basically you're working and then it's hands or
Yeah. So it looks kind of like I don't want to freak people out, but it looks kind of like a
well, let's do it.
like a spider kind of. It's got like four. It's got 4 arms, and so
Stop.
the robotic cart just wheels up to the patient, and everybody's scrubbed in. It's sterile. Got sterile drapes on everything, and the robotic cart gets kind of mounted to these special robotic ports to the patient, and it knows where it is in space, and as far as the proprioception of the arms.
So you're
And then
physically controlling it.
I am at the
Whoa.
robotic console, which is over in the corner. So I'm controlling the arms from the console. I'm controlling the camera from the console, while the patient is, over here, still on the operating table to my left. It's pretty crazy.
But it's really super precise.
It
Like even
is.
more than obviously a human hand,
Absolutely.
which
Yeah.
is why you use it.
Yeah, and it has actually allowed a lot of surgeons that over the years you'll start to sometimes develop an essential tremor, just kind of a little bit of a tremor if you use your hands for something a whole lot.
Sure, right.
So a lot of those surgeons have been able to get kind of back in the game and become, really productive again, because it accounts for that. You're not going to have any kind of essential tremor to worry about.
Okay,
So
or like an arthritis or any or
yeah,
a hand injury or anything
absolutely.
like that where
Absolutely.
it can do it for you.
Yeah.
That's so cool.
Yeah.
So, what are some of so we think about OBGYN and you and I talked about it when you were here before, um is obviously, you know, seeing women, for their yearly
Hmm.
exams, obviously delivering babies.
Right.
That's like the fun part.
Right.
But what are some of the other things that you see throughout the year?
Um, so the vast majority of my visits, if they're not annual visits or obstetric visits, are going to be what we call problem visits. If there's
Yeah.
something going on, if somebody's having uh, painful cycles, abnormal cycles, things like that.
We
Um,
women are so complex.
yeah, no,
Darn
and
it.
that's okay. That's good. Um, but yeah, if there's something going on, that's a huge percent of the visits that we see to try and help fix that. And then as you go through life, different problems arise, and so I see a lot of patients for as you transition through menopause. I see a lot of patients for that transition.
Yes. When you
Um,
get to my age and all these weird things start happening,
Hot flashes, and just all
29,
yeah,
it's crazy how
yeah,
fast it is,
it's
29.
crazy. 29, huh?
Yeah.
Wild.
It is so crazy. No. But no, it is funny as you have friends that you grew up with, right? And you have
Hmm.
friends you went to college with and whatever, and you're all about the same age. And it's funny, in your 20s, we would get together and have dinner and we would talk about boyfriends and, whatever. And then you get into your 30s and you talk about kids and then, whatever. And now we get together and we're like, have y'all started hot flashes yet? And I'm like, God, this is
Yeah.
ridiculous. But it is an age and it
Mhm.
is a chapter in your life,
Yeah.
and don't be embarrassed by it or whatever. You just have to
Absolutely not.
it's just we can't help it, man.
Hey, and shout out to my mom. She texts me every morning and she says, "No, Robert, you be nice to those menopausal women," because she's of an age, and every morning she texts me, "You be nice to those menopausal women." Hey,
Thanks, Mom.
yeah, shout out to mom.
No, I'm not quite there yet, but no, it's as a woman, and I'm sure Ashley can attest to this, it's just like weird things happen. And sometimes you're like either embarrassed or like you feel alone or you don't know whether it's something you should seek treatment for or whatever. What would you say, to somebody that's like, "Oh, this weird thing is happening and I'm even embarrassed to call the doctor about
Yeah.
it."
There is almost certainly nothing that I haven't seen or that my partners haven't seen before. There is no reason to be embarrassed by anything like that. It doesn't matter what the issue is. We've probably heard or seen worse. So that's a huge part of women's healthcare. It's a very intimate, private thing, and you have to be able to trust your doc. You have to be able to trust your healthcare provider, your midwife, whoever. Um, but yeah, try and develop that trust with your provider, and it doesn't matter what's going on. We're not there to judge you. We're there to help you. So
Yeah, and I think that if you can get your mind past that, like, I promise you, you're not the first time anybody's seen something like that. And if you are, that's even cool.
yeah,
Like,
well, you never
it's
want to be
awesome.
cool to your OBGYN.
No. But
Interesting.
no, but I love your answer because that's a reason and that's a true testament to why you have such a wonderful following as well. I hear such wonderful things about you and that's why because your mom texts you every morning and tells you how to be.
You be nice. Yeah.
No, I think you're that way by nature for sure. So, okay, so accepting new patients, are people allowed to call you and get in with the doc?
Absolutely, absolutely. You can call our phone center at 740-446-5381. We also have online scheduling available for all of our providers at www.holzer.org.
Yeah, and if you have not checked out holzer.org, it's a wonderful website for so many different reasons. I mean, you can pay your bills online, you can schedule online, you can chat with your doctors. There's all kind of things that you can do throughout that website that can kind of make your life a lot easier.
Absolutely.
You
And
haven't
yeah, they
checked it
have
out.
access to the patient portal on there. So if, a lot of times patients will see results before I even get to see results. It's
Yeah.
like you can get access to that stuff like
It's
immediately.
wild. All you have to do is set up
Yeah.
an account,
Yeah.
set up your account, and then, if you have a test run, you wait a day or two or however long it takes for them to read it and, full test results on there. And um, so yeah, you can
Yeah, and
see.
you're your own best advocate that way because the doc has several hundred patients that they're worried about and they've got to get through all these
Correct.
different results for everybody. Whereas if you're your own best advocate, you're on your chart, you're looking at that stuff immediately. So
It's like, yeah, like you say, oh, wait, okay, that test result's the same as last year and we're hoping it didn't change. So cool. I don't have to worry about it anymore. I have to wait for the doc to call me and say, you don't have to worry.
yeah.
So that's a good thing.
Yep.
Um, all right. And so this is kind of getting deep, but like can we go through maybe like a timeline while you're here? I think it's kind of fun and we have you for a minute.
Yeah.
Of different stages of women's health.
Yeah.
Like, when should a girl start seeing you and for what? And then, transition throughout her life. Pick Sally.
Yeah.
Sally is
So,
now
yeah.
16 years old. What should
Right.
Sally do?
So the vast majority of patients that I see in their teenage years, so Sally comes in at 16 years old, most of those issues are going to be because of irregular cycles, and sometimes pregnancy.
Which
So
is
that's
totally not abnormal,
that's
irregular
super
cycles
common.
and all that.
Yeah, super common, especially at that age. The parts of the brain that control your cycle are maturing for years and years and years, and that is very common to see, especially in the teenage years, even from the very start of when women start cycling, or as early as 9, 10, 11 years old. And I'll see patients through that entire spectrum of ages. As you get a little bit older, around the age of 21, unless there's some very, very specific factors that most people in this area don't have, then you'll start with your pap smear screening, which
Around
is
21.
age 21 is when
Okay.
you start, and that is to screen for cervical cancer, and it is the most effective screening program in the world.
Isn't that wild?
Yeah, it is unbelievably effective at
And very
detecting.
simple.
Yeah, and the reason it's so successful is because we can detect precursors to cervix cancer much earlier than actual development of a malignancy. So
Okay.
it's very important that you get in starting at age 21. Again, unless you have very specific indications like human immunodeficiency virus, HIV, things like that.
Okay.
Get in at 21 unless you have those things going on, to start that screening. And it does not have to be every year. That's common misconception. So early on, we recommend specifically cytology, which means we're looking at the cells under the microscope.
Okay.
We're not doing human papillomavirus-based screening at that time. So HPV is what causes the vast majority of cervix cancers.
And there's a vaccine for that now,
There
right? Like that didn't
is.
exist when I was growing up, or if it did, I didn't know
It
about.
did actually. It's
Oh.
been around for several decades.
Then was it not pushed for people like
It wasn't
my
very
age?
popular when it first came onto the market because there was a misconception that we're vaccinating our teenagers against HPV. It's going to encourage them to have unprotected intercourse and all kinds of stuff.
Well,
I-
I hate to tell you this, but
it's going to happen
probably
anyway.
gonna do it anyway.
It's going to happen anyway. No. But yeah, initially it wasn't super popular and has since gained a massive amount of popularity, and it's basically universal for adolescents to get the Gardasil vaccine. Which
When do you what age do you get that vaccine?
so you can start that as early as the recommendation is 11, but the FDA has approved it for as early as 9 years old.
And they for girls and boys?
Yeah, girls and boys.
Because
and
let's
that
just
is-
be honest, the boys
yeah.
have something to do with it too.
They do. They do indeed. And the vast majority of males will not be symptomatic with HPV infection.
Mhm.
So nothing ultimately happens with that. But they're carrying it and
The girls are the recipients.
handing it
of
around. Yeah.
Thanks.
But yes, absolutely recommended that males and females get the Gardasil vaccine,
Okay.
typically starting at 11. If you start at age 9 to 11, then it's a 2 vaccine series.
Okay.
If you're a little bit older, then you might have to do a 3 vaccine series.
Okay.
But yeah, definitely recommended.
All right. I mean, if you can prevent things before they start, doesn't that make sense?
Oh, for sure.
Nice.
Yeah. An ounce of prevention. Yeah.
Yeah. Okay. All right. So we talked about that, and so then Sally gets to past 21, and she moves up in age.
Yeah. Yeah. So typically, after you've started your pap smear screening, we're just talking about routine well woman care, which is, making sure your pap smear is up to date, encouraging self breast exams if you're not doing those and how to do those.
Yes.
And then typically, if you're having any issues, we will do a clinical breast exam at that time as well.
Okay.
I usually talk to my patients about, do they want a pelvic exam at their annual? Are they having any problems? Because it isn't necessarily recommended to do a pelvic exam every single year if you don't have anything going on. It's just kind of
Okay.
an unnecessary, uncomfortable exam. But the vast majority of my patients are like, I'm here, just make sure nothing's going on. So,
I mean, yeah, I get
Yeah.
that thought.
um,
Why not?
And really, we're just checking for abnormalities on the cervix. We're checking for abnormalities with the uterus and with the ovaries. So do you have any big cysts? Do you have any fibroids, which are benign tumors of the uterus, things like that? But yeah, and so then as you move through the years, as you get into your 30s and 40s, we're typically talking about that's when some of the what we call pelvic floor dysfunction starts to rear its ugly head because you've had a few kids and things don't sit quite where they used to sit. Or, one of the really, really common complaints that I see personally is I can't go jog, I can't go laugh, I can't pick things
sneeze.
up, can't sneeze, or here it comes, I'm gonna pee my pants.
Yeah.
So that's a common one that I see. And a new service that we're offering at Holzer is pelvic floor physical therapy, which is a dedicated physical therapist. And she works with those patients to strengthen the pelvic floor muscles because that's a muscle, and to help keep them dry. So, and lots of other things too, but.
And see, so that very thing that you just mentioned, number one, is something that, we girls all laugh about and whatever, but you don't want to laugh because then, you pee your pants. But, which is not, it is very common, but probably not normal, not good.
It's not necessarily normal. It's super common, and there's definitely a taboo surrounding it.
Yeah.
It's like, everybody.
It's one of those things that you don't want to go talk to your doctor about, but you should.
Yeah, when you're talking to your girlfriends, you're like, oh yeah, that's a thing. I don't want to laugh because I'm going to pee my pants.
Right.
But yeah, you should talk to your doc about that.
Yeah. Because there are things that you can do that are pretty simple to help that along the way.
For sure.
But that's where you come in. Now, you said that things aren't necessarily where they're supposed to be anymore. Could you kind of expand upon that?
I will elaborate.
Yes.
It gets a little bit graphic, but sometimes
let's talk about it.
Yeah. Sometimes
it's Monday.
Yeah, it's a Monday, April Fool's.
Right?
Sometimes the anterior wall of the vagina, the posterior wall of the vagina, or the top of the vagina itself, it's not supporting the bladder, the rectum, or the uterus the way that it should.
Okay.
And so the bladder can kind of fall into the vaginal cavity. That's called a cystocele. The rectum can kind of pooch into the vaginal cavity. That's called a rectocele.
Okay.
Or the internal, specifically the bowel, the small intestine, the large intestine can kind of fall down through the top, and that's called an enterocele.
This sounds terrifying.
Yeah.
So how do you know if this is happening to you?
Most patients complain of pressure, and there's a bulge down there that they didn't used to see. Yep.
Okay.
Typically not super painful. If you have a lot of pain involved with pelvic floor dysfunction, there's probably something else going on.
Okay.
But yeah, a lot of patients describe pressure and something down there that didn't used to be down there. So.
Okay.
Yep. For sure.
And this is no April Fool's joke.
Not an April Fool's joke. And we can put that back where it goes.
Okay.
It's called.
So you can fix that.
Yeah. It's called a colporrhaphy. Is what it's called.
You don't have to learn that word. It's fine.
No, just I tell my patients all they know that I say colloquially we call it a bladder tuck. So
that we can remember.
Yeah, bladder tuck. And then another thing that I do, my partners do it sometimes, but I do the vast majority of them. It's called a tension-free vaginal tape. That's a mouthful, but it's basically a tiny little skinny piece of mesh that goes underneath the urethra and helps you stay dry. So keeps you from laughing, coughing, sneezing, and peeing your pants.
Okay.
Yep.
And again, I just think it's important for ladies to understand that this is, it's not like an abnormal thing. It's not right, but it's not an abnormal thing.
It's not normal, but it is unbelievably common. Yes.
Yes.
Absolutely.
So don't feel like you're alone in that, and don't be afraid to go talk to your doctor about it, because wouldn't it be a lot nicer to not have to deal with that situation?
For sure.
Yeah.
For sure.
For sure. Okay. And then so as we get a little bit older, how often are there times where you do go to a yearly PAP, or, when does
there are indications if you start having abnormal PAPs because you have a history of HPV infection or other things, then you can fall into a more frequent screening guideline that would be annual PAP smears. again, a lot of my patients, they just prefer to know, and they say, I'm here for my annual and I'm going to get my PAP.
Right.
So that's fine. I absolutely will do that for patients. That doesn't mean that you have to do that every year. As long as you're having normal results, you can space those out a little bit. And it varies based on what testing you have done to every 3 to even every 5 years.
Okay.
But most of my patients, they're going to come in for their annual and they'll be like, yep, let's do the pap
Just go
smear.
ahead
You're
and do
here.
it.
Let's do it.
I mean, what it's not hurting anything to do it.
Right.
And it gives you, if it gives you peace of mind, cool.
Absolutely.
So when do we start with women with mammograms and things such as that? When
Absolutely.
do we graduate to that fun stuff?
Yeah. So yeah, that's where we are exactly
I know
is
that the ages have changed over years.
right.
Yeah.
So a big change specifically that I want to highlight is the age of colonoscopies has decreased from 50 for a lot of populations to 45 for everyone. So not just colonoscopies, I should say, colon cancer screening. It used to be that in Black and African American populations, screening guidelines were 45 years old. And everybody else, 50.
Yes.
That's when you started screening. Everybody's 45 now. You start screening at 45 for colorectal cancer. Whatever screening you want to do, there's the Cologuard, which is just a DNA test. There's colonoscopy. There's a virtual colonoscopy. There's a lot of different screenings that you can do. But
Okay. And I know that's not your department, but when do you know? How do you know what's right for you? Because like the Cologuard, for example, and I mean this is graphic, but I mean whatever. It's Monday, and I've taken cold medicine, so I'm just going to
we're
talk
already
about it.
talking about vaginas.
We're already talking
and
about
stuff.
weird stuff, but
Yeah.
I had a colonoscopy, and they found like I think 6 polyps or something, which
Right.
terrified me. I was like, "Oh my god, what does that mean?" And they're like, "Don't. It's just we fixed it. It's fine."
We got them
But
back at 5 years, probably is what they
yeah,
told you.
so okay, cool. So but like the Cologuard is like, I'll let you explain that.
So
how that works.
you literally just take a stool sample and they test it for specific high risk DNA. And the Cologuard is for low risk patients only. So if you have a family history of colon
I was gonna
cancer,
say, how do you know
you
if
have a
you're low risk
personal-
or high risk?
right? That's something that you're going to want to talk with your doctor at length about what screening is right for you.
Okay.
But those patients that have a history, a family history of colorectal cancer, especially if it's early colorectal cancer,
Okay.
or if they have any kind of DNA mutation that makes them high risk, specifically like Lynch syndrome, used to be called hereditary non-polyposis colorectal cancer syndrome, HNPCC. Yeah, there's a
All
mouthful.
right.
But that's something you're going to want to talk with your doc about. There's
Okay.
the breadth and width of colon cancer screening is probably more than what we're ready to cover today.
Yeah, and that's not. Yeah, that's definitely not your main focus and what
but,
we're
you
here
know,
to talk about today. But
yeah, I definitely offer that to my patients.
Yes, you
because
wanna
I am
talk to your
primary care technically. So,
and that's how I ended up, in talking with my OBGYN. I mentioned something. That's how I ended up getting my colonoscopy, was because he was like, "Oh, I don't like that.
right.
Let's do this." Yeah.
But back to mammograms.
Yes.
The recommendation varies from society to society. Now, the American College of Obstetrics and Gynecology, which is the one that is like dedicated for OBGYNs,
Yes.
ACOG recommends starting mammograms at 40 and having a conversation with your doctor about starting them at 40.
Okay.
So if you're someone who's higher risk or you have genetic, mutations that predispose you to breast cancer, that's going to change the recommendation for when you start screening.
Okay.
And again, you're going to have to go through that. It's a pretty extensive conversation with your doc to figure out, are you someone that needs to start early with mammograms or breast ultrasounds or otherwise?
Well, and I feel like, isn't it kind of like a family history deal? Like
Yes.
my mom, my aunt, my sister,
It absolutely
everybody has
is.
had breast cancer. Like we probably are going to start this way earlier than somebody else.
That's the broad strokes of it, absolutely.
Yeah.
But for normal risk patients, 40 years old is when ACOG recommends starting those mammograms.
And again, listen, mammograms are not fun, but they're necessary. And Holzer has the coolest mammogram now. Have you had that done?
The
Have you-
3D mammogram.
It is so neat, and it if you can get to take an actual look at it, like, because it basically is a mammogram, but it kind of like divides it up into slices, so you
Hmm.
can like zoom in and zoom out. It's
Yeah.
really cool.
So, and they call it tomosynthesis, I think is the fancy word for it. That's the fancy word for a 3D mammogram.
And it doesn't hurt nearly as bad as the other one.
It is less painful for
Yes.
patients. You get better imaging.
Yes.
And I think whatever the governing radiology society is, their recommendation, I think, is leaning towards everyone using screening with 3D mammogram. Now, there is a slightly higher dose of radiation
Okay.
with 3D mammogram. And so you have to take that into account. And that's a conversation, again, with your doc.
With your doctor.
Yeah. If you're somebody who has to get them every 6 months because of risk factors,
Yeah.
maybe you should just do the classic 2D flat mammogram. It's less radiation, less concern there.
But again, it's all case to case, and it's
Absolutely.
and be your own advocate. If you don't feel like you're like, I don't know about all that radiation, I don't know if I like
Right.
that or not, say something.
Right. Absolutely.
It's cool.
Yeah.
I mean, you don't get to tell everybody what to do, right? Like you have that conversation.
I am just there to give you my recommendations. I am not there to be paternalistic and tell you this is what you're going to do. So I'm just here to talk to you about your options.
See? Okay, so mammograms, are they every year then at 40 on?
Yes, it's recommended you get an annual mammogram unless you have something else going on, and then we might follow up with additional images or more frequent mammograms. And we talked about colon cancer screening. When you're in your 40s and 50s is when we start to kind of ask questions about any family history of osteoporosis.
Okay.
And we start to think, okay, is this someone who needs early screening for osteoporosis, especially when you're in your 50s?
Okay.
Typical screening is going to start around age 65.
Okay.
But that's when you start to kind of, okay, is this somebody who needs earlier screening? And also when you're in your 40s and 50s, that's when kind of classically menopause is kind of approaching.
That's when you get with your girlfriends and have some wine and laugh at each other.
Yeah, laugh about the hot flashes.
Yeah.
That's right. So average age of menopause in the U.S. is about 51 and a half years. That's average. A little earlier for some populations, a little later for others. But I start seeing patients with complaints about what we call perimenopause, or the time around the start of menopause, usually starting around age 45, give or take.
Okay.
You'll start having some of those night sweats, some of those hot flashes, mood changes, estrogen levels start to drop a little bit. So,
What causes this whole thing? I know it's not what we're here to talk about either, but why did the good Lord do this to us?
it's kind of one of those things where the
serious, like, ongoing April
Yeah.
Fool's joke. It really
Yeah,
is.
it is. No, honestly, the ovarian reserve is the fancy word that we use. The ovarian reserve starts to kind of trend downward,
Okay.
and so you're not developing as high quality eggs every month, and so those estrogen and progesterone levels aren't the same every month, and so you're not getting the same feedback to the part of your brain that controls your cycle every month. So
Things
cycles
start getting erratic.
Right. Cycles start to either space out or maybe get closer together. It can kind of go either way.
Yeah.
And then you'll start to develop some of those symptoms of hormone changes. So the hot flashes, the night sweats, low estrogen changes can cause the skin around the area of the genitals to change. And we call that atrophy is what it's called. It's not a very nice term, but
Okay.
anyway. And then definitely the mood changes can happen then as well. But it's definitely a spectrum, and it is a long process that can
It
last
goes-
years.
Yeah.
So people
It's like a sick joke.
sometimes have a misconception that it's like, oh, I went through menopause this day. No, it's years of managing symptoms, and
And
I'll
I'm
see
sure
a lot of that.
some people, obviously have a harder time than others with it.
Absolutely.
You just don't know how your body's going to react, I would
Yeah.
guess.
And we're finding more and more that the brain and the brain chemistry is what controls a lot of those, what we call vasomotor symptoms. So hot flashes, night sweats. It's not so much just your estrogen level, but estrogen plays a role in your brain chemistry, and your brain chemistry is
It
what
all ties
controls that thermostat. Yeah.
yeah, the nights, like I just personally, I haven't really noticed anything other than waking up in the middle of the night and just
Drenched.
like drenched
Yeah.
and like, what is happening?
Yeah.
So
No, that's super common. And the first thing that we always recommend is lifestyle changes. So dress in layers, especially if you're going to bed. If you start off cold, be able to take off, sweatshirt, take off sweatpants,
Sure.
whatever. And also other behavioral changes. They have these really cool fans that go underneath your bed and like blow air under the sheets.
ooh,
Yeah. You can get them on Amazon. Yeah. Check
thanks
it out.
Amazon.
Yeah.
Thanks, Jeff.
Yeah. But and then we can talk about other some of the over-the-counter remedies, black cohosh, stuff like that, to
Oh.
alter estrogen levels. And then if all those things are unsuccessful, we start talking about actual pharmacologic agents
Sure.
like hormone replacement or other things.
I feel like, most people certainly would want to try anything they could before you started getting, into prescription medicine and all
Yeah,
that. But
yeah.
we should have you come back and we could talk about menopause one day.
That'd be great.
I can
Yeah.
tell you all my little things. And
Yeah.
what would be fun is to get like a little panel of women together that are
Yeah.
of different stages.
And we
and
could
we
could
could
go
kinda
through
chat
questions
about it.
for sure. That'd be
Yeah,
awesome.
that's a good. Keep that in your mind, there, Dylan. Okay, so those are kind of the. So once we get
Stages.
into menopause, then it's just like
Yeah.
whatever. And then when are you ever done getting like your yearly exams and all that? Like, are you ever like, I'm done with you?
You're never getting rid of me.
Okay.
Not completely.
Dang it.
Now,
Love you, but dang it.
phase things out, yes. Usually around age 65.
Okay.
If you've had routine, normal Pap screenings, then you can stop
Okay.
around age 65. And again, it's a conversation with your provider. If you are 65 and you're single and ready to mingle, maybe you should continue your Pap smears. But
Okay.
that's definitely a conversation with your doc. And then also joint, shared decision making around age 75. Some people will stop mammograms.
Okay.
But again, shared decision making, is that something that you want to do? Are you high risk? Like what is your life expectancy moving forward? All those things come into play.
Okay. Again, it's an individual basis, and
Absolutely.
that's a conversation to have with your doctor.
There you go.
All right. So Miss Ashley is not here just to look pretty this morning, although she is looking real pretty this morning. But you are here to talk about like the last half of the questions that I have written here, and this is like super bizarro to me. So I'm gonna let you kind of cover it. But you are accepting new patients,
Yeah.
correct?
Yeah,
So you can
absolutely.
call and schedule
Yeah,
that. So yeah.
Absolutely.
But so one of the things obviously that OBGYNs do are delivering babies,
hmm
and that's kind of the fun part.
It is. Yeah. Keeps you on your toes.
It would.
Yeah.
Like you just you never know what your schedule is going to be,
You
That's
don't.
right.
which is where you come in.
A lot of
But
times,
so you actually I'm reading this and it says to ask about placenta donation.
yeah.
So I guess first off, if you don't know what that is, explain what a placenta is, and then let's talk about that situation.
Okay. Placenta is the amniotic sac that is in mommy's womb that helps supports baby throughout the whole pregnancy.
So it's what the baby, the sac that the baby is in,
Mm-hmm.
that keeps it
Yeah.
safe and healthy and
Yeah. And
fed and all of that, right?
yeah. In addition to like the membranes, like when your water breaks, that's the membranes, the amniotic sac is rupturing. And then the actual placental tissue, that's what the baby uses to breathe, to get rid of waste, to get nutrients, to make hormones early.
It's
And
insane.
yeah, it's a
human body's
crazy organ.
crazy.
We were talking about it earlier. It's
Like,
it's an
it's-
unbelievable organ.
Yeah.
And so that's what it is.
So there's all kind of, let's just be honest, good stuff within the placenta.
Absolutely.
There is.
So
So, Lifeline of Ohio has started this program in 2019. Holzer has been involved in it since 2022. So, any mommy that is having a C section can donate their placenta after delivery. This does not change anything about the patient's delivery, and this does not cost the patient anything. And we recently hit a milestone that we celebrated. Holzer has had 100 placentas donated since the beginning of the program in 2022.
Yeah.
Wow.
Yeah.
Good
So-
job. So why just C-section?
It is, to say, the cleanest route to get
Okay.
that placenta.
I got
So,
you.
yeah.
Okay.
Fairly, not completely bacteria free, so to speak, but a much more sterile procedure doing a
Okay.
C-section than traditional delivery,
Okay.
where, I mean, we're talking about, exponentially more bacteria exposure.
Okay.
So
That makes sense.
Mhm.
All right. And so, well, let me just back up here. What do they do with these said placentas?
Yeah, they make grafts. So they're called healing grafts, and they can be used for a wide range of procedures for eye, oral, spine. They can also be used to heal
Yeah.
difficult wounds like diabetic ulcers, venous leg ulcers, and burns.
yeah.
So these
What?
grafts,
That is amazing.
they've been shown to promote natural healing, decrease inflammation, scarring, and pain. So
Yeah.
yeah, and on average, one placenta can make 25 grafts. So we've had 100 donated so far. So you're looking at a possibility of 2,500 grafts from those donations.
And that's just from Holzer.
Just from
That's just
Holzer.
Holzer, yeah.
Amazing.
And there are a lot of hospitals that are involved in this donation program, but
Mm-hmm.
we like to think we're the best.
Well, heck yeah. So, how? Number one, I guess. I don't want to be judgy, but why would you not?
It's a great question because, normally,
I mean, what
the
happens
placenta-
to it if you don't donate it?
there is a biohazard service that we use, and
It
they're
just gets
just
thrown away.
disposed of. Yeah.
Mhm.
Yeah. Some people, I don't want to get too in the weeds on this. Some people want to take it home. There are lots of different things that people will do when they take their placenta home. Some people will plant a tree. Some people will do other things with it.
Make pills.
Yeah, some people get it
smoothies.
dehydrated and make tablets out of it.
To consume.
Mhm,
Yeah.
correct.
Yeah,
Okay.
and I am not.
Hey,
Judging
listen,
anybody's
in the wild,
decision?
mothers,
Absolutely.
like
Yeah.
dogs eat their placenta.
Yeah,
and,
deer, all
whatever, like,
kinds of
it's-
things. Yeah, it's
It's
nutrient packed.
very healthy.
Not here to
probably.
judge.
No.
It's not something I would personally pursue, but if that's what you want to do, great. But normally, if you're not taking it home with you, it just gets disposed of.
Okay, so which means to me, or sounds to me like, why not?
Right.
Sure.
Absolutely.
Just donate it.
And it's no cost to the patient. I think you already said
Yeah.
that. And
And nothing, no well, okay, here we go. Well, they're going to do an unneeded C-section on me just so that they can have my placenta.
absolutely
No.
not. No way.
I can hear
Um,
it now.
So definitely, the vast majority of donations are coming from scheduled C-sections that are either for history of a prior C-section, history of a prior uterine surgery, because of a baby that's breech,
Yes.
and it would be more dangerous to do a vaginal delivery than a cesarean delivery. Typically, those donations are coming from those patients.
Okay,
Now,
that they know it's coming.
right,
Mhm.
and it's way ahead of time.
Yeah.
I don't think I've had a patient who, came in for an induction of labor and the intention was to have a vaginal delivery and then ended up needing a cesarean delivery for some reason. Either, baby was too big,
Just
whatever.
wasn't happening.
I don't think I've had anyone who donated their placenta under those circumstances.
Okay.
So absolutely not. We're not going to be like, let's go do a C-section because we can get that placenta. No,
Correct.
not going to happen.
Okay, so it's kind of planned ahead of time.
Yeah, certainly.
So how does one participate in this program then? If you're like, okay, yeah, that sounds great. I mean, I want to help others.
Well, a lot of times we have posters in our rooms, so patients are already looking at that, using those QR codes to look at Lifeline of Ohio's website to get more information.
Okay.
But you'll come see me typically at the end of your pregnancy if we're scheduling a C-section, and
'Cause
then
she's
we'll
the scheduler.
Yeah. And we'll go through some education, and we'll talk about that. They'll get Lifeline of Ohio's phone number at that time, but they will contact them within 2 weeks of their procedure to ask them some health screening questionnaires.
Okay. So, and again, so a lot of this is planned ahead of time and,
Yeah.
and on the up and up and all of that. And so that is wild. So they can actually make like, they just help others with
They
it.
do. They
Yep.
That's
do.
so good.
Yeah.
It is awesome.
Yes, it is. All right. Well, that is something that you certainly could consider, and it's not just Holzer. I'm sure that other, places are participating in this program
Yeah.
as well. So,
Yeah.
if you're watching and this is just a throw out for everyone, ask.
Yeah.
Yeah,
Definitely.
Ask
Absolutely.
about it.
And just to touch on a few frequently asked questions that I'll get.
Yeah.
This doesn't have anything to do with cord blood banking. If you guys have heard of cord blood banking,
No. What's that?
that's where you donate, you don't donate. You collect the blood from the umbilical cord, so it's baby's blood. It's rich in fetal stem cells and all kinds of stuff, and you pay a service to store that on ice, basically, and deep freeze. If in the future your baby had some kind of illness and
Yes.
required what we call pluripotent stem cells, if they had like leukemia or something like that. So
Right.
that is a cord blood banking
That's a
service.
whole other situation.
Doesn't have anything to do with this at all.
Okay.
And again, I'll emphasize no cost to the patient, no additional procedures that are necessary. We just collect the placenta as we typically would. The surgical techs have a little bit of a special procedure after the placenta's out that
Okay.
they take care of on their end.
You'll never know anything happened.
Yeah, nothing different. So,
No, I think that is absolutely amazing. And if you can help others along the way, I've just always been the kind to not understand. I don't even want to get on the whole organ donation thing because I don't understand. You don't need them. So why not donate them? But anyway, that's that's my opinion.
well, and that's not to belittle or belie how significant organ donation is. I mean, it's a huge undertaking for, especially if someone is not already identified as an organ donor on their driver's license or something like that.
Yes.
Family members have to decide
Yes.
for them, if they're obtunded or can't communicate themselves, are they going to be an organ donor? That's a huge process. It's a big deal. This is really
No,
easy.
it's not.
This is as
Yeah,
easy as
right.
saying, don't throw it away, give it to somebody.
Right.
So,
Because it's going to literally get thrown away.
yeah.
Yes.
So, okay. I think that's amazing. Wow. And you can help
Yeah.
others. Oh,
Yeah.
that's so good. Well, cool. Well, what else would you guys like to talk about while you're here?
I don't know either.
Yeah. I don't know. The Reds won their first game. Did you see that?
So good.
Yeah.
And I will say that I picked in the total media pool, I picked Purdue to win the NCAA championship. So
Uh-huh.
we're still in it.
Well,
Final four anyway.
hey, there you go.
So see us all positive. It's
There
a
you
happy
go.
Monday. So okay, I've got a question for you then. This has
Okay.
nothing to do with anything that you guys do with work.
Okay.
Has anyone ever pulled an April Fool's prank on you that was like good? Like that you're like, oh man, they got me.
My
me.
nurse.
Oh yeah.
My nurse got me pretty good. I'm hesitant to even tell this story.
Oh, it must be really good then.
My nurse, her name's Cassie. She is a very outgoing, very outspoken, kind of extroverted person.
Uh-huh.
And I am also her doctor. And so she has been single for decades and decades and decades. It's just not something that interests her. And she jokes about it all the time. Well, she came in for her exam and it was, I went in and I was going to be completely professional. I was going to she bought some fake cobwebs.
Oh my God.
And if you can imagine,
Awesome.
if you can imagine that exam, and she tells that story to everyone. This is not a HIPAA violation by any
That is
means.
so
She
good.
tells that story to everyone she meets. No HIPAA violation here. She hid the cobwebs where you can imagine. and I was just completely taken aback. She got me. Anyway,
That's probably one of the best I've ever heard.
I'll never forget. It was terrible. She's probably gonna laugh when she sees this.
That is awesome.
Yeah.
Yeah. No, I don't have any stories like that. How
No.
about you?
I'm not too exciting. Yeah.
No, I came in today and I don't know if Dylan, can you find the Halloween situation?
The what?
The Halloween situation where Jeremiah tried to kill me.
Oh yeah, I'll find
The
that.
Halloween situation.
There was a Halloween situation. So I'm driving to work
Hilarious.
this morning thinking of that. And I was thinking it was April Fool's, but now that I think about it, it was Halloween. Where so the first thing I was going to do this morning was look behind that curtain
the green screen.
because did you find it?
I'm really struggling to find it. Give me a second.
Yeah. So on Halloween this year, Jeremiah, and it was like forever. It was like 2/3 into the show. Jeremiah hid behind that screen, and then like it just rando jumps out and like grabs me, and I thought I was gonna die. I mean,
Wow.
that was like, and I cannot believe that totally inappropriate words did not come out of my mouth, but I don't think they did. But so I will give them that. That was not April Fool's. It was Halloween, but they got me.
Well,
And everyone just thought it was just the funniest thing, except for me.
not bad.
Actually, it's pretty funny.
So my dad was my insurance agent. He worked for State Farm for years.
Yes.
And I found a picture of the same kind of truck that I drove, but it had been like bashed in the front. And I sent it to him. And I said, I hit a deer, man. I'm going to have to turn in a claim. And he's like, calls me and he's like,
Oh, no.
And I was like, April Fools. And he was like, that's not funny, man. That's not even, I was wondering if you were okay. Like, I was like, that's the best kind of April Fool's joke when you're
Right,
like
I'm okay.
questioning someone's safety. Yeah.
Exactly.
Heartless, man.
That
Ruthless.
is heartless. That's pretty rough.
That was a bad one.
Yeah.
But no.
You haven't done one to someone?
Not that I
There's no
remember.
way.
Yeah.
No way.
She's too sweet.
She is. She's
you
just the
find it?
nicest.
I only managed to find the vertical one, but it's still really funny.
Shove it, Freddy Krueger. So I saw, God, I wish I had sent it to Dylan. I hate you! Oh my God!
Wow.
Yeah, that happened. Shove it, Freddy Krueger. So I saw,
I don't know
God,
why
I
I
wish
can't
I had
remember
sent
why I
it to
said
Dylan. I hate you! Oh my God! That was like a bit obnoxious, but completely honest response to that.
I'm still waiting for the April Fools to happen.
I know.
Mm.
That's when I walked in. I saw
Every
Jeremiah, and I'm like,
Yeah.
don't even.
Every time I come on this show, last time I was here, it was the Bengals were in the playoffs, and like somebody tossed me the Bengals hat. You remember that?
Dang it.
Yeah. No. Okay.
Shoot.
Well,
Well,
next time.
we have a few minutes. You just never know.
All right.
All right. Well, I'll tell you what. I want to thank you guys for spending the morning with us. It's always so fun to have our friends from Holzer here, and to talk about all the interesting things that you get into, because it is a wonderful thing. Again, could you tell everybody how to get scheduled if they would like to see Dr. Bowers or one of the OBGYN doctors?
Sure, absolutely. You can give us a call at 740-446-5381. All providers have online scheduling, so you can also go to www.holzer.org.
There you go. Oh, and real quick, while you're here, televisits. Are you doing any of those?
Yes.
Those can come in handy as well.
I do video visits. I do telephone visits. Right now, there's some restrictions on doing those visits across state lines. So
Okay.
if any of my patients are watching that are located in West Virginia, that's not an
Not
option
something that
for
you can do.
them.
Okay.
But certainly those patients who are in the state of Ohio, we can do telemedicine, no problem. We have those capabilities.
And what
So,
would be a good reason to do a televisit versus, coming in to see you?
a lot of patients are
Appropriate.
doing, like med rechecks. So, if I start you on, something for a urinary tract infection,
Okay.
and I just wanted to see how you're doing. Are your
Okay.
symptoms getting better? That'd be a very normal follow-up visit to do on telemedicine to say, hey, yeah, I'm better.
And you can just do that from work or whatever. You don't have
Yeah.
to take off work to go,
Absolutely.
all the way into the clinic just to do that. So it's just a matter of convenience for everybody.
Absolutely. Yep.
Okay. And, Holzer does that throughout. So even your primary care physician, whatever, you can get a hold of them and talk with them that way. And if it's just convenience.
Yeah, for
Mhm.
sure.
Yeah.
So, and of course there's reasons why you wouldn't want to do that, but
Fair. Yeah.
I think that's just a really cool thing. And how do you get those set up? Same way.
Same way.
Same
Yeah.
way.
A lot of patients will actually message me through the patient portal and say, hey, could this visit be a telemedicine visit instead of an in-person visit? And that lets me say, okay, is this something I can do telemedicine, or are they going to need some kind of exam?
Sure.
And so then I can message them back and say, nah, you probably need to actually come in for this because XYZ, or no, I think we could probably make that work.
Okay. And that's the best thing. Just ask, right?
Yeah.
Absolutely.
No, and it's a really cool thing about the patient portal is you have a lot of access to your healthcare providers. So
Right. And it's like something that you never had before. Would have to call and then they'd have to call you back or whatever. And this is
Right.
almost just like a messaging thing.
Right.
Yeah.
absolutely,
It's very easy. I mean, I'm sure you all have a million messages to answer, but
got a few.
it's convenient that you can just type an answer back and
Mhm.
that's
Yep.
cool.
And my staff is really, so I was on vacation last week. My staff is really good about making sure that those messages get sent where they need to go to like other providers if it's something urgent.
Okay.
It's like, oh, this needs addressed now. But if it's something that's not as urgent, then definitely it might take a day or two, but we'll get back to you.
Okay. See, and there you go. That's yet another service provided by our friends at Holzer.
There you go.
Very good. All right. Well, thank you so much for spending your morning with us. We appreciate it. And we will be back tomorrow. Weather not looking all the best this week. It's warm
I
out
saw
there
some
today.
snow flurries
It-
in one of
it's
the predictions.
Super bizarre. Like
What?
some really kind of gnarly thunderstorms
Yeah.
and stuff coming through the
Hoping
area.
it-
So
yeah. Hopefully it was April Fool's.
there you go.
Hopefully.
Yes. We'll go with that.
Yeah.
No hail or other things. So, all right. Have a great day, and we'll be right back here tomorrow. Thanks for watching. Bye-bye, everyone.
Bye.